First on the agenda is our district attorney.
I believe my request pretty much speaks for itself, Mr. Chairman, and I would just ask that the committee approve it.
I'll move the resolution. Hoatling?
Second it.
All in favor?
Aye. Aye.
Opposed? Carried.
Thank you, everybody.
Thank you, sir. Next is solid waste. Jolene.
I'm asking for authorization to create and fill one full-time laborer's position in our department. Primarily, this position is needed due to the increased workload. We're adding new programs, also for additional staffing on the weekends. What I'm finding is I don't have enough staff to carry over when people call in. So this position will be Tuesday through Saturday. They will carry a Weightmaster's license and be trained on the scale. They will also assist during the week with mowing because we're starting our mowing season and we rarely ever get summer help. And additionally, they will be doing the new food scrap program.
Hey, Jolene, I have a question. Since it's not budgeted, is it budget neutral? Do you have another place within your department and budget that you can pull the money, or is it a request to increase your overall budget? And if so, where is the money coming from?
Okay, so I do. I have a position that I can freeze. So that'll be roughly anywhere between 22 and 24,000, depending on how many hours that individual would have worked. And also I have a bookkeeper's position that we won't be filling until late fall. So I do have funds to cover it for this year.
Great, thank you.
And that should be indicated in the resolution where the money's coming from?
I can do that.
Yeah,
Okay.
that'd be good. Yeah.
Okay, we need a motion.
I'll move it.
Second, Rick.
All in favor?
Aye.
Aye.
Opposed? Carried.
Thank you.
Public health, Jack Mann.
Okay, so we have a bookkeeper who is transferring to facilities. We keep our bookkeepers very busy here with grants and whatever, so it definitely is a needed position to fill.
Okay.
I'll move that.
Jack, I just have a quick question. I'm so sorry.
Well, first of all, can we get a motion in a second?
Yeah.
And then we can ask questions? Okay, so.
I made a motion already, Matt.
Okay.
I'll second it.
Okay, all right, discussion?
So if I'm reading this correct, Jack, the position is budgeted at the 44,698, but the incoming hire is the 37,993 listed in the salary box. So it's a savings, even though the vacant position didn't have longevity, they're just going to get paid less.
It's the 15%.
Oh, is it the step system?
Instead of. Yeah.
Okay. All right. Thank you.
Any other questions? Okay, we had a motion and a second. All in favor?
Aye.
Opposed? Carried.
Thank you.
Thanks, Jack. Next is highway, Tony. Tony, you're muted.
Sorry about that. Looking to fill one vacant budgeted position of motor equipment operator 1, grade 12B, and this is due to a resignation.
I'll move that.
Second.
Simmons.
Okay, all in favor?
Aye.
Aye.
Opposed? Carried. That's it?
That's all I got. Thank you.
Thanks, Tony.
Tony, do we have any candidates?
What's that?
Do we have any candidates?
I believe I have 1 or 2 applications in there, yes.
Good.
Yep.
Sheriff Kraft.
Yes, hi, thank you. Well, everyone else seems pretty easy compared to what I have here. But we're looking to fill several positions. Our first one is a personnel request to fill a full-time budgeted civil clerk's position due to a resignation from the position.
I'll move it, Hoatling.
Second it. Guzzi.
Guzzi? All in favor?
Aye.
Aye.
Opposed? Carried.
Thank you. Second is an authorization for personnel to fill a vacant resignation for a full-time corrections officer position.
Move it, Simmons. Second, Rick.
All in favor?
Aye.
Opposed? Carried.
Thirdly, hope everyone had a chance to read this one. We currently have an open lieutenant's position and an open sergeant's position here, which will cause vacancies in the once promoted vacancies in a deputy's position. We're looking to front fill those deputy positions in order to get some more staffing into our academy, which starts in June. Right now, we are severely understaffed, and this would be a great help for us to get that staffing back up and running for the 2023 year. Obviously, those recruits will not be graduating until that year. But obviously, once we promote the deputy sheriff's lieutenant and deputy sheriff's sergeant, those positions are going to be open and vacant anyway. So let's look at the front fill those two positions.
Move it, Simmons.
I do we have a second? Then I want to have discussion.
Second.
All right, second. Just so you're going to abolish the lieutenant and the sergeant's positions?
No, we're not looking to abolish that, Chairman. We're looking to just take the positions those positions once they're filled. So once I fill the second lieutenant's position, I'm going to have an open deputy's position.
Okay, so we're going to have to change the resolution because it said that the lieutenant and the deputy sergeant would be abolished.
I don't see that here.
I didn't see it.
Yeah,
On the bottom, approved resolution, deputy lieutenant and deputy sheriff's sergeant would be abolished.
It's saying the backfills would be abolished.
Oh, yep.
Those backfills will be abolished.
I have a question, Sheriff. So what are we waiting for to be able to put the next person into the next two people? It looks like you're, promoting within. That's why there's going to be backfills. Is it that retirements or resignations are coming, but they're not there yet?
No, we have an open position. So my position as sergeant was backfilled by Peter Greskow, who was a sergeant. So his sergeant's position is open. And also the lieutenant's position, which we talked about last month, for the second lieutenant's position, where we abolished the senior investigator's position and budget neutrally changed that title to a lieutenant. We would be filling that too. However, by filling those two positions now, we're taking away from the road. We're already severely understaffed. And we don't want to do that right now because it's going to take away from personnel that are answering calls for service. So I can't fill the other positions, the lieutenant and the sergeant's position, because it'll reduce my staffing on the road even more.
So you're looking to bring in the two deputies, and then as soon as they're in and trained, move up the people that are moving up.
Correct.
Okay.
We have three that are actually four that are just finishing up their field training. They should be out by June. So hopefully in June we can at least fill one of those positions. But right now we need to get these bodies into the academy, the June academy, so we have them up and running for the beginning of next year.
Okay. The only question I have in terms of front loading, Jim Bragg, are we able to do that?
Yeah, right now he's running well under budget, trending through where we're through 7 or 8 payrolls, so it should be okay.
Okay. So I need a motion to approve.
I'll make that motion.
Motion Jim Guzzi, second.
Second.
Okay. Any further discussion? All in favor?
Aye.
Aye.
Opposed? Thank you.
So the next is we're looking for authorization to fill a vacant part-time clerk typist position due to some new legislature, sealing orders on marijuana arrests and so on and so forth. We're inundated with more administrative duties. So we're looking to hire a part-time, and that's already been budgeted, clerk typist position.
So we need a motion.
I'll move it, Holding.
Motion Supervisor Holling, second.
Second, Rick.
Any discussion?
Is there a reason the pennies are going out to the fourth place, 1764.89 an hour? That seems odd.
Yeah, that's the number we got from payroll. So
Okay.
we wanted to be very accurate.
You think hourly rates go up 4 decimal points?
So,
All right. So we have a motion and a second. No further discussion. All in favor?
Aye.
Opposed? Carried.
so similar to the front filling of the two other positions, we had two deputy sheriffs go to the state police. They were granted a 6-month leave of absence. We're looking to front fill those positions and abolish the positions that were caused by them leaving after that 6-month period.
I do have a question. What's PCP?
It's civil service.
Okay.
Isn't that like permanent contingent? I forget what that stands for.
Yeah, I think it's permanent contingent position. Yeah.
I forget.
I'll
That's
move it, Holding.
Second, Basson.
Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
And then lastly, we're looking authorization to fill, or actually to create a full-time deputy sheriff's position for a member of our civil division. We're looking to start a position for a civil deputy. Currently, civil is mainly is pretty much the backbone of the revenue we're bringing in. It used to be the jail, but now the civil division is really the backbone of the revenue generating for the county here. We had a hybrid position that Zach Sahotra was working and still is working. And during the last 2 months, he's served 136 civils. The average per deputy is 10. And he's also been able to alleviate at least 69 hours of overtime call out. That's in the service of evictions is usually $107 per eviction plus mileage. So out of those 136 services, a majority of those have been evictions. So he's really taken a large portion of the civil work already and single-handedly done this for the last 3 months. So we're just looking to create that position so we're not tying that SRD position up currently.
Okay, we have a question from Supervisor Simmons.
Yeah, I was just wondering if you feel this is going to stay permanent, or is it just to alleviate the backlogs of cases out there?
Yeah, this would stay permanent. I mean, civil is getting more and more a larger part of what we do on a daily basis. It always has been, it's one of the 4 divisions we have here at the Sheriff's Office. Due to the moratorium for evictions being over, we're really getting hit hard now. But the money that we're looking to use for this position is mostly budgeted. We had $45,000 in the budget, and we talked to Jim about that was for retirement. What's the word I'm looking for? Incentive. Thank you, Rebecca. Retirement incentive that we didn't need it, and there was also a position for a clerk's position that wasn't included in the budget. So that would have helped out as well. So out of the $51,665 salary, we already have $45,000 of that covered. So we're hoping to keep this going and make this a permanent position to stay with the Sheriff's Office at least through the next 4 years.
I'll move it, Simmons.
We have a motion. Need a second?
Second, Basson.
Okay, all right, discussion. I'm assuming, Sheriff, that we could offset this position with the revenue that this deputy brings in?
Yeah, absolutely. He's bringing in $1,000 to $2,000 a month just by himself with the evictions and also reducing the amount of money going out by reducing the amount of overtime. Every time we have to do an eviction, it's a minimum of a 3-hour call out to get a deputy to cover that, because it's above and beyond our regular patrol duties. So just the money he's bringing in, the money we're saving is going to cover his salary without even looking at that 45,000.
Okay. Second, any other questions?
I guess, now that this is at an all-time high, my concern is what happens when it gets leveled off, Sheriff?
Right.
You know, now where are we going to be? Is this position then going to be carrying itself or not? You know, I know right now we got a backlog, but my concern is after that, you know?
Yeah, no, I totally understand. And, the contingency with that is, we don't need a supervisor running the civil division. We currently have a first sergeant running that division. We're looking to utilize him in a more administrative fashion, to utilize his skills to be able to cover a more broad spectrum here at the sheriff's office. This is an interim thing. We need to move some pieces around throughout the remainder of this year. Just coming in, as I stated when I came in January, the first quarter of the first year is going to be reviewing data and acting on that data, and that's basically what we're doing right now. Is just looking to fill some of the holes that we see here in the sheriff's office, bring in more revenue, and reduce the amount of overtime. So, definitely, if it becomes something that's going to be a burden, we'll say to the office here, and not generating revenue or being cost effective, we would definitely reevaluate it.
Thank you.
Again, do we have any other questions? We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried.
Thank you very much. Appreciate everything.
That's it, Chairman.
That's it? Okay, thank you all. Oh,
Rick's got a hand up.
Yeah,
One
Rick.
quick question, Sheriff. Is it your policy or the department's policy to grant a 6-month leave of absence for anybody that leaves for another law enforcement agency, or is that civil service law?
Yeah, so the sheriff's office is one of the actually grant a leave of absence. I believe most of the other agencies within the county do not do that. In the past, it was a year that was granted. I felt that was inappropriate, being in the condition we are here. So we gave them the ability to have 6 months. I mean, we do put a lot of money and time and effort into training these deputies, and we would like to have them come back, but we understand that we can't compete with the state police through money and also through benefits. So that's just the way that if they find that it's not for them to go to the state police, they're not out of a job, and we're regaining the money that we're losing by them going to another agency. So I just felt it was appropriate to at least grant some leave of absence.
Okay.
Thank you.
Thank you.
Okay, I need a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
Aye.
Carried.
Take care.
Thank you all.
Bye, everyone.
with a skeleton crew, I'll bring this Health and Human Services Committee meeting to order 19th, 2022. We'll start with Mr. Kevin McDonald for Office of the Aging.
Actually, it's Michelle is in for Kevin.
Oh, I'm sorry. I thought you just was a willing participant.
No, that's all right, Supervisor. Kevin is off. He's on vacation this week. So as you can see, he submitted the monthly report, and I'm here to answer any questions anyone may have. Yes, Supervisor Adams.
I have two questions. I wondered if the report might be amended to include the number of signups or registrations for Everhome, so that we'd have a sense of how the pilot is moving. And I also wondered if there's an update on the hiring of the home health care aides. Kevin had said last month that he thought he had 2 prospects for the 2 slots.
Well, we actually have 3 aides. So one aide was hired. We're up to 3 right now. And we probably will be looking to hire a 4th aide, but we don't need them quite yet. We just got a new ISEP referral today. And we're looking at our schedule because we have one client who may be moving out of state to live with her daughter. And if she decides to do that, then we could fill the slot with that particular person.
But I see we have 2 towns that have had unserved clients for several months now.
By their own choice. One of them, the person in Greenport, has been offered an aide numerous occasions, and she has a private pay aide right now that she's been using and would prefer to stick with her. And in fact, the case manager had a conversation with her today because she had a reassessment, and she's going to call back tomorrow and let us know whether or not she's going to continue that way or if she would like to use one of our aides. And the other person is new in Claverick, and it's a similar situation. There's a family member involved with that person's care, and the family member would like services at a certain time of the day that right at this point we can't offer. We've offered different times, but this particular family member is coming in. So at this point, really, there isn't anybody on the waiting list who truly is without services. It's more a choice because they didn't want to accept them for the time that was offered. And we do our best, obviously, to meet their needs and pick a time that's convenient for them. But when you're traveling from New Lebanon to other parts of the county, you do have to try and group people together as best you can.
Thank you.
You're welcome.
Are there any further questions for Ms. Cram? Well, thank you so much for joining us and speaking on Kevin's behalf, Ms. Cram. With that in mind, we'll move to Jack Mabb, Department of Health.
Okay. I believe the first resolution is for a bookkeeper. Yes. So one of our bookkeepers here has taken a transfer to facilities, and we're in need of filling that position.
I'll move it, Morel.
Can I get a
Second, Healthy.
Discussion? All in favor?
Aye.
Opposed? Carried.
Okay, so OD2A is our grant from the state health department. I think I've talked on these meetings about how the Healing Community Study has kind of gobbled up all the money as far as doing services in the opioid crisis. So in some respects, it's a little difficult at times to actually spend the OD2A money. But in this particular case, we have 12 recovery coaches who are we trained through this grant back a couple of years ago, and they have a need with the state of New York's requirement that they have ongoing training. So this is to contract with an individual from Rochester to do a virtual training for these 12 individuals who are essentially employed through Twin County Recovery Services. And as an aside, today, just about half hour ago, I got an email from Carl Quinn, who runs this program, that Columbia Memorial Health has expanded and is having one of our recovery coaches embedded in their day from 8 to 5. And that's huge. we got a lot of resistance from the hospital when we initially wanted to place them up there. Not a lot of resistance per se, but they kind of struggled with how it would work. And this is a very successful, one of the most successful programs in the state. So we want to continue to support the recovery coaches, and that this is one way of doing it.
Terrific. Can I get a motion?
I'll second it then.
Discussion? All in favor?
Aye.
Aye. Opposed? Carried.
Okay, so we received the Public Health Corps grant in 2021. We allocated a certain amount of funds for 2021 and the rest in 2022. The program really hasn't taken off. The state makes it very difficult because they have very defined job descriptions that don't match up with the needs of local small health departments. So we simply want in this resolution to transfer the money from 2021 over to the 2022 budget.
Okay, can I get a motion? I'll move it. Can I get a second? Discussion? All in favor?
Aye.
Opposed? Carried.
Okay, this is, we have no money in the Public Health Corps grant lines for non-personnel expenses, paper and other things. So this is just a transfer. We had to get permission from the state, which we did, to transfer 10,000 out of personnel over to the to a supply line.
I'll move it, Helsley. I'll second it.
Discussion? All in favor?
Aye.
Opposed? Carried.
This is a similar situation to the other grant, the Public Health Corps grant. This is the schools reopening grant. The CDC is the grant source. This was supposed to end in June of 2021. They've expanded it out to July of 23. And we had funds left in 2021 that we want to move over to 2022. As you can see, it was $1.5 million. We've expended almost 500,000. A lot of the other million is encumbered, but we'll be spending it through the rest of 22 and into 23. So we just want to move it over to 22.
Do I have a motion? I'll move it. Do I have a second?
Second.
Thank you, Abdu. Discussion? All in favor?
Aye.
Aye. Opposed? Carried.
So there's the one thing I wanted to update you on is that, we've been talking about the numbers in the chairman's release on Fridays creeping up. We are getting a bump up. Last week we had 99 cases, which is the most we've had in a long time. We had 38 on Monday. Last week we have 41 yesterday. We had 16 on Tuesday last week. We have 21 today. So this bump up is sort of continuing. We currently have 4 people in the hospital. Nobody's on a ventilator. Nobody's in the ICU. So that's the good news. But I think that this little bump up is going to continue for a while.
Yeah, especially with those masks coming off in the airplanes, right?
Well, and I think that has something that the mask coming off in general into society. Although it's interesting with the schools, we just haven't seen huge bump ups in the schools. And the cases, when they still do contact tracing in the schools, and when they track them back, they're tracked back to home or something going on in home, birthday parties and things like that, and not necessarily transmission in school. So it's kind of an interesting thing.
Jack, how's the vaccination going? Is that dropping off? And what about the booster for 50 and older? Is that being received well or not as well as you had hoped?
Well, I think we're seeing what we expected. When we had the first booster, we did the first week that we had the first booster, we did like 240 cases, and it dropped down to 180 the next week. It just kept dropping from there. This booster, we started at 130. the first week it was available. Last week was 85. As of today, we're there on Thursdays from 3 to 5:30. As of today, we're in the 30s, as far as signing up. So it's doing exactly what we expected it to do, stepping down. We're never happy about that. We would like to see it, but we are in a county of well over 80% of the population having received at least one shot. So I think we're in good shape in that department. But I'd like to see a lot more people coming in for boosters.
Okay, thank you.
And do we know any more about the subvariants that they're advertising? Well, I shouldn't say advertising, reporting on in central New York. I mean, is their transmissibility any greater? Severity of illness?
We are finding it, and I think that the state believes that they're responsible for this bump up. It is B2A is the dominant strain right now. We got a report out of Wadsworth last week that listed something like 15 different variants, all slightly different in terms of B2A, B2AB, B2A3, whatever. And so I think that there's a lot of variants bouncing around out there. One of the things that we're seeing, and we're only seeing a few cases here, is that we're seeing some people that test positive on home tests. We had an example this morning. We had somebody who tested positive on a home test, asked for a test here, confirmatory test here. We did a PCR. They were negative on the PCR, but they were positive on the antigen. And so we're starting to question, and we've already sent it into the state of New York, is it possible that this virus has mutated enough that maybe they're not testing out consistently with the tests we have? And that's certainly a possibility. But it's not, in our case, it's not many cases, but we're asking of the state is if they're seeing it elsewhere.
Jack, with the
sorry.
variants, they are less severe though, correct?
Yeah, and I think that and what's happening in Columbia County mirrors what's happening in the country. Our hospitalization rate just isn't there. I asked about the 4 that are in the hospital now, and 3 out of 4 are unvaccinated people. And that was a trend that we saw earlier on with Omicron. And they do have, one of them's a senior, one of them has a lot of comorbidities, even though they're in their 50s. So I think it isn't as severe. And that's the real plus here, that there's a lot of people out there getting it without the masks. I was at a meeting last week. It was the very first meeting. I'm on a board of a nonprofit here. Our very first in-person meeting on a Tuesday night, and Thursday morning, one of the people at the meeting sent an email out to everybody. Oh, by the way, I tested positive for COVID, just so you know. And I think that's what's going to happen to a lot of people. I think it's going to reach out, and it's just going to get a ton of people. So the good news is it's not as contagious. The good news is it's not as virulent. I mean, it is contagious, but it's not as virulent.
But if people get boosted, won't that keep lower the hospitalization rate?
Yes.
Okay, so that's why we want to encourage the booster campaign so that we can keep hospitalizations down.
Yes. That's the big thing. It prevents severe illness.
All right. Is there anything further you'd like to highlight on your report, Jack?
No, I think that's it.
All right. Do we have any questions for Mr. Mabb? All right. Thank you so much, Jack. We truly appreciate it.
Thank you.
Next, we're going to go to Director Almasi, Human Services.
Thank you, Chairman. Good afternoon, everybody. Nice to see all of you. Just one resolution to present today. This is a resolution requesting your support to onboard a contractual psychiatrist. As you know from previous discussions, staffing remains an issue, both for social workers and for prescribers. In this case, we have identified a part-time psychiatrist that we would like to contract with for a total of 20 hours a week.
Okay, do I have a motion?
Hopefully.
Do I have a second? I'll second. Discussion?
I had just 2 quick questions. Dan, for my information, could you tell me what, in terms of the Schedule A, acceptance of a minimum of 40 cases and production of a minimum of 6 cases. What's the distinction between the two, and why is that based on 7 hours a week versus 20 hours a week?
It should be 7 hours per day for a total of 20 hours per week.
Okay. So we need to look at Schedule A.
Yeah, can we pull up Schedule A so I can see what we're talking about?
I don't know if I have Schedule A, sorry.
It's at the end of the contract.
Yep. Let me see if I can find it for you.
And the other question while we're waiting for that is, are these for in-person or telemedicine or both services?
Yes, this individual will be brought on site, so they will be able to offer all 3 services, which are face-to-face, video, and telephone.
Thank you.
Yeah, if time doesn't allow for it, I can certainly circle back to you and pull up my own Schedule A and respond offline, if that's okay, or if you'd like me to answer it.
No, I didn't understand it. That's all.
All right, any further discussion, questions for Mr. Almasi before voting? And I just asked Dan before this, if we were going to be able to cover this with various things. Dan, could you speak on that really briefly?
Right, so sure, what's happening here in terms of the finances is as follows. There is monies that we're using from one of the employed psychiatrists that have since retired. And then, so that's not been filled, that's been vacant. So we have dollars from that bucket, so to speak. And then we also have dollars from contractual relationships that is ending between the county and Columbia Memorial Health. They were providing us a contractual psychiatrist as well. So you combine those 2 buckets and you come just shy of what it would cost to cover this individual. So there is somewhat of a gap there. The gap or the deficit in terms of covering the cost of this 20-hour-a-week psychiatrist will be covered by federal salary share dollars for 2022. In terms of going forward into 2023, we'll have a conversation about how we're going to cover the cost when it comes to discussing our budget for 2023. So we'll be looking into that later on in August. But there's a couple of variables to just see how they perform, how they work out, when in fact they're going to actually start. We have a projected start date for them of early June. Hopefully that materializes. But I've learned to not count on anybody starting until they're actually here with us. Anything can happen is what I'm trying to say.
But it's quite ubiquitous that staffing is an issue with all our departments here.
Yeah. So I see we have Schedule A up. Supervisor, if you could just direct me to which
Points 5 and 6.
5 and 6. Okay.
7 hours contracted per week. 7 hours contracted per.
Yeah. So the minimum, that speaks to the rate at which we expect the prescriber in this case to perform, the efficiency that we expect them to have. Minimum, I'd like to see that in the 45 to 50 cases per 7 hours worked. They should be able to manage a caseload of minimum 40 cases, but again, 45 to 50 cases per 7 hours worked. In terms of production of a minimum of 6 billable services, again, that's just a minimum. I like to see that in terms of us scheduling between 10 and 12 individuals with them in a 7-hour period. Keeping in mind, they do 20-minute med reviews, sometimes 30-minute med reviews. So in an hour, they can do 2 billable units, up to 3 billable units if they're doing 20-minute med reviews. They can perform 3 of those in a 60-minute period in an hour. So this is just setting the bar at an agreeable level, but their schedules will be a bit beyond this, a bit over this.
So is it per contacted per day or per week? For 7 hours. Per contracted, per,
Uh, it should probably read per day. Yeah,
thank you.
yeah. We'll amend that and get the amended version to Kelly.
So both, both 5 and 6 should say per day.
Any other questions?
Chairman Morrell, did I hear Chairman Morrell ask a question? Both 5 and 6 per day?
Yes.
Okay.
Should read per day and not per week, both number 5 and 6.
Yeah, except the minimum of, yes, per day. Yes.
Okay, we have a resolution authorizing DHS to contract for psychiatry services. We have a motion and a second. All in favor? Aye. Opposed? Carried. Thank you, Director Almasi.
Thank you, everybody. I appreciate this.
Are there any questions outside of this resolution for Mr. Almasi? Forgive me. All right, thank you very much. With that, we'll move on to Commissioner Gibson. Mr. Gibson.
Thank you, Chairman. Appreciate it. Good afternoon. I have several resolution requests here and then a few topics for discussion, so I'll move as briskly as I can and answer any questions. The first, requesting an authorization to transfer funds from my 6010-2000 line, which is an equipment line. I had put 25,000 in there in anticipation that we were going to switch our network over from the state to the county, and then was told a little bit probably just after the new year this year that things were going to be moving more slowly on that score, and that transition wasn't going to happen this year. And the equipment that I thought I was going to have to get, I wasn't going to have to get, which is good because I'm combining my adult protective services unit with my homeless unit. And that required some moving around here in the building, and it required me to build a couple of extra offices. So the transfer would be over to my building maintenance line so that I could cover the costs of that construction.
All right, do I have a motion?
I'll move it, Morrell.
Do I have a
Second, Helsley.
Discussion. All in favor?
Aye. Aye.
Opposed? Carried.
You'll note on a couple of the requests that I have this afternoon, grant funding has sort of prompted me to do this. As most on the board probably are aware, mostly at the state, but even some at the federal level, there's been a tremendous amount of grants made available during COVID and as we're sort of transitioning out of COVID for any number of reasons. For my purposes, mostly to enhance our services and resources and for housing and displacement. And the second request that I have on there, there's a grant available to enhance adult protective services to respond to COVID-19. And since we started to do an awful lot of work virtually per the state and per the feds, and they requested that we sort of get a little more proficient in scanning and being able to do things by email and assisting our clients with doing the same. We've decided to use part of this grant to purchase 3 new scanners so that we could up our capacity on that.
All right, terrific. Do I have a motion?
Motion on this.
Do I have a second? I'll second it. Okay.
All right.
Supervisor Helsley. Further discussion? All in favor? Aye. Opposed? Carried.
Thank you. So resolutions 3 and 4 are sort of, they're very much related, and I've brought this to the committee before, but with the Family First legislation having passed, not in this session, but in the previous session, there was changes to the laws on children going into congregate care. And that's whether ordered by the family court or if my services department seems to think that maybe it would be best for the child to do that. So what the change that the law brought is they needed to see qualified individual assessments on each child that it was proposed would be going into congregate care in order for there to be that assessment could be then checked by anyone at the state level or anybody at a facility that wanted to give a second look at that, just to make sure that indeed congregate care was needed for the child. Interestingly enough, we had been moving as far away from congregate care as we possibly could, and the law has been moving that way, particularly for juveniles or so-called juveniles, and so it's really more in keeping with the way the law is going to go, but that cost gets passed on to the county. By way of having to find individuals who are qualified to make those assessments and to send the child for an assessment accordingly. And so in resolution number 3, you'll see one consultant who does provide that is Melanie Miller. And as we're going to need those assessments at the ready, we would ask to be able to enter into a contract so that those services could be provided per diem, which, essentially when necessary.
Okay, do I have a motion?
Helsley.
Do I have a second? I'll second. Further discussion? Okay, all in favor?
Aye.
Opposed? Carried.
And just to limit my discussion on resolution request number 4, it's the same background, and the LaSalle School also has a staff that's available to make these assessments for us. And so we would request that we be able to enter into an agreement with that institution in order to provide the same.
All right, do I have a motion?
I'll move it, Morel.
Do I have a second?
Helsley.
Discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. And as far as the last resolution request, number 5, that will also entail me using grant funds that have been made available through also for housing purposes and the like. So there's been an awful lot of monies left over that we never did get to use for displacement and other areas. And so I was told if we don't start to use this money for one reason or another, we would lose it. And I thought, well, that's fine, until it was brought to my attention. As some of you may know on the board, along with the Department of Human Services and some other service providers around the area, and several supervisors on the board, that we've been in discussions, several different types of discussions on how to provide services on an emergent basis for those who are either suffering from mental illness, alone or mental illness in conjunction with substance abuse. And that has led to a greater discussion on what a rural county like this can do to address crisis stabilization without creating what is called a crisis stabilization center, which, a rural county like ours seems not to meet the criteria for. So we've started discussing perhaps a wellness hub where there's services from each and every provider in the county, and there would be space made available there. So we've begun those discussions. There would be, it is proposed, there would be a homeless / warming center building. There would be a detox center. There would be health and human services available. They're probably locating substance abuse services available on this hub. And so Greenberger, who has sort of been leading the way on this, found an architect who could offer us a rendering of these different services and how they would all fit on a campus over in Greenport on land provided by Calaruso and Sons. In any event, there was a need to bring monies forward for that rendering. And rather than go to the county and ask for any of the stimulus money that had been set aside, I checked with my staff to see if we could use some of our remaining grant money to pay for this rendering, and I was told that we could. And so we then have to enter into an MOU and a service contract with the architect in order for us to do that, and therefore resolution request number 5 being on the list. But that would be fully funded with grant money. That would not cost the county any money.
Terrific. Do I have a motion?
I'm those.
Helsley.
Okay. Further discussion. Any questions for Commissioner? All in favor?
I have something I want to say.
Go ahead, Supervisor Mussman.
I think I want to thank Commissioner Gibson. I think it's a great idea. Thank you very much.
Indeed.
Thank you.
Thank you, Supervisor. Any further questions? All in favor?
Aye.
Opposed? Carried. Now, Commissioner Gibson, we do have something at the end of this concerning salaries. We talked briefly, and perhaps in relation to that, I would make a motion to go into executive session to discuss medical, financial, credit, or employment history of a person or corporation. Do I have a second?
I'll second Helsley.
All in favor of going into executive session?
Aye.
Aye.
Okay, I think we're gonna have to wait for a minute for the devices to be disconnected. All right, public, if there's any out there, we're back. Thank you for your patience. One more thing from Commissioner Gibson on DSS. Commissioner?
Thank you. Yeah, I wanted to update the committee on a discussion regarding transportation, which actually began back in 2019 and was picking up some momentum into the early parts of 2020. And we all know what happened in March of 2020. And it certainly tabled these discussions. And these discussions were around, what to do about outlying areas, particularly in the eastern part of the county, where it's just not really been cost effective to set up any kind of public transportation just yet, because it's hard to gauge what the need is, and it's hard to dedicate a bus to go out to New Lebanon or to Canaan, make its way through Chatham and even consider Copake. So a couple of the supervisors from those towns thought, well, is there anything that maybe the DSS transportation department is equipped to help on that score? So we just started to talk about that and to see if there were any creative solutions. And I thought, well, maybe there is. I mean, we're certainly sending our transportation department out to pick up people in New Lebanon who have to come in and recertify for benefits. And we're doing that for folks that are in any town that can't come in and recertify. So we started to talk about, well, would it ever make sense to maybe pilot something once, maybe twice a month, where you send a van out to New Lebanon with the idea that you're going to maybe pick up a person or two that's going to come in and recertify. And if you were going to do that, could people from New Lebanon hop on and maybe take that into Chatham and hop off in Chatham? And as the van made its way back to Hudson and people recertified, and for that matter, could those residents from Chatham or even New Lebanon stay in the van and come into Hudson and do things in Hudson while certain people were, maybe taking care of business at DSS? And then, we'd have a set time for the departure of that van from DSS back to Chatham and then back to New Lebanon. And those folks who came in on that van, they would get back on and they would make their way back out to Chatham and make their way back out to New Lebanon. So we continued that discussion. Just recently, Supervisor Adams came in from Canaan, and Supervisor Hoatling was there, and Supervisor Collin was there as well. And I thought it was a really productive conversation, and I think one very much worth delving into a little bit more, because I think if we were to say decide that once a month or perhaps bi-monthly or twice a month, we would set up where I would get one of the drivers here to go on out to New Lebanon at a certain set time and make its way to Chatham and then make its way into Hudson and then go back, just to see if in fact that ended up picking up some kind of momentum where the van would be filled. I mean, I already have the van. I already have a transportation driver who could do it. But if we started to demonstrate that, well, you know what, that van continues to fill up, and it looks like there are folks out in the outer regions who would like to come and make their way south through these towns like Chatham, and they're willing to pay $1 or they're willing to pay $2 or they're, whatever it might be to do that, we would start to be able to inform the county transportation committee, well, it looks like there is this much need. It's not enough for a route constantly to be going out there, but maybe a small bus once a month on this type of route would make some sense, and it looks like it could work. So, I say all that it certainly piqued my interest, and it seemed to me like, well, maybe that's that's something that we should think about trying, because, you know, over the course of 6 to 12 months, maybe it would lead to a bigger pilot where the county would send, you know, one of its county buses out once a month and along the same route. And in so doing, you know, my clients who are coming in to recertify could actually hop on that bus. And we would start to increase transportation in the county. So that's the sum and substance. And I'll certainly turn it over to Supervisors Collins and add that. But very interesting thought. And, you know, one that I think I'd certainly be interested in pursuing.
Mr. Chairman?
I would just like to recommend that you speak to the Transportation Subcommittee about it, because there have been discussions about doing routes beyond the regular routes, and there may even be some funding for that. But I think that it all needs to be coordinated. I don't want to see us going in a lot of different directions here.
Right.
And the chairman of Transportation Subcommittee is Michael Chimides.
No, I think that's an excellent point. And he, Supervisor Chimides, has been made aware of these discussions. And as part of, as you're aware, Chairman, we're talking about the transportation plan for the county generally. And so I'm making sure I'm bringing this up at those meetings so that it can be discussed and nothing does get duplicated.
Supervisor Adams?
I just wanted to add to what Bob was saying, and also to appreciate what Matt was saying. I think we were thinking, if the buses are going out, to the extent that we could fill the buses, it's the same cost per bus whether you have one person on it or 8 people on it. So especially with the cost of gas, wouldn't it be better to provide a broader array of service, but also to make it more cost effective?
All right, thank you. So maybe pending further conversations with Supervisor Chimides, maybe we can have this on our next month's agenda, Commissioner Gibson?
Yeah, I will continue to put it on for discussion, and I am a part, as I said, of that Greater County Transportation Committee, so I'll be bringing updates to that and from that to this committee.
All right, terrific. Are there any further questions for Commissioner Gibson? Supervisor Adams?
I just wanted to ask about a couple of things on your report, Bob, if that's okay.
Absolutely.
I see that we had a big uptick in protective and domestic violence this month, as well as also in homeless intake. I think homeless intake generally goes down this time of year because the weather's starting to get better. Do we have any background that would tell us why that these things are happening?
So on the homeless, you know, it's sort of curious. I wouldn't be surprised if I had a high number there and it stayed steady, because over the last couple of years it has stayed steady through April and into May.
Okay.
That it gets bumped up is curious to me, and so something I am talking to my director about. Something I'm also talking to my CPS director about is just what you brought up, and you know, we're noticing that. Is there any, you know, there's really no explanation. Numbers were a little down all the time that we were, you know, that the schools were going either partially or entirely remote. And that's for reasons that would seem obvious to us. But they've been back. And you know, you're seeing reports go up. Now, some of them are educationally related, which is to say that there's just there's attendance problems and other tardiness problems. And so we're certainly addressing those. And then some are in the DV range, and it remains to be seen why that is, but we're studying that very closely.
I also from $399 to $588.
That's correct. And we're doing a lot more transporting now, and that's been growing. But you know, I am trying to utilize that service for just about everything that I can, including getting folks to work, if I can possibly get them to work, with the thought that I'd rather use the resources than have people have to turn down jobs because they can't get out to those jobs. So I expect to stay steady on that for a while.
I think that's a positive to see the transportation number up.
Yeah, I mean, it certainly hasn't taxed us anymore. We have the drivers and we have the vehicles. We're just hoping that we're actually hoping it goes up to bring it down, if you will.
Thank you.
Thank
Supervisor Cousin?
I wanted to piggyback on what Brenda was saying about the domestic violence. Through helping a constituent, I learned that our shelter that is usually in Columbia County is not functioning at the moment due to staff shortages. And I was just wondering what the county is doing to help house residents, since there is an uptick in domestic violence numbers, and if there's something that should be done to, are they getting sent out of county, and is there something that we can do to keep folks in county for both emergency shelter and the 90-day period that they would have been given if they were able to get into the shelter provided by Community Action?
Yeah, so excellent question, and it gives me a chance to sort of bring everybody once again up to speed, because this is a very different sort of program. So when it comes to the Community Action and the DV, that is something supported by my budget. But the legislature made a change to that a couple of years ago, which is very understandable because they are trying to protect identity. So the best way to say it is folks get placed into that shelter in a manner not through this agency. And I'm made aware of the placement because I'm, as the agency overseeing the allocation of those funds, I must be made aware of that. But I'm not made aware of who is getting those services unless those folks want me to be made aware of that. It is entirely confidential now, even to this agency. So I don't know what happens, and I am aware of the problems right now with staffing, and I am aware only because the director has called me and to keep me apprised of this. But that's one of the things where the shelter system in New York generally takes care of that. So unfortunately, if they're not able to be housed in Columbia County, they are housed in another county. I do not know where. We will continue to pay for that housing. But that's part of the overall general state program of housing DV victims and their families. So is it a problem? It's certainly a problem for Columbia County residents who I'm sure would rather stay closer to home than
so I guess the deeper, my question a little bit deeper is just like, is there extra precautions taken? Are they considered homeless for the time being if they're looking for housing? I understand about, the shelter not being able to give you names, but if somebody is reporting that they're a victim of domestic violence to the county, what is the county doing to keep them safe and house them somewhere?
Well, we'll certainly house them as homeless. It's preferable that they actually go into a shelter if they can do that. If they go into homeless, as you know, Supervisor, then we have a motel or a motel room to house these victims and their families. Not ideal.
Thank you.
All right, any further questions for Commissioner Gibson? All right, thank you very much, Commissioner Gibson. We really appreciate it.
Well, thank you, and I thank the committee for the extra time today. I know it took extra time for everything, and I appreciate that.
All right, I hate to do this. Does the committee have a little bit more time? Just for a quick discussion?
I'm good.
All right, I'm going to make another motion to go in executive session to discuss the medical, financial, credit, or employment history of a particular person or corporation. Do I have a second?
I'll second.
I'll second.
Okay, all in favor?
Aye.
Aye.
Commissioner Gibson, I'd ask you to step out of the meeting, but
And
thank
I
you
will,
so
so
much
that
for
this
all your
does
work.
not concern my agency. I will, and thank you. Bye-bye.
Thank you.
No, there was nobody watching.
Do you have any further commentary from the committee or visiting supervisors?
I'm sorry I was late.
Thanks for a good meeting.
Well, thank you, everybody, for coming in. I appreciate that.
Motion to adjourn.
Okay, Chairman Morrell made a motion. Favor?
Aye.
Aye. Opposed? Good night, everyone. Thank you for staying
Good
on.
night.
the
Good night.
Good night, everybody.